This is a reading of Urology by Keyes. Urology, diseases of the urinary organs, diseases of the male genital organs, the venereal diseases, by Edward L. Keyes, Jr., MD, PhD, Professor of Urology, Cornell University Medical College, Surgeon to St. Vincent's, and Urologist to Bellevue Hospital, with 204 illustrations in the text and 18 plates, 4 of which are colored. New York and London, D. Appleton and Company, 1921. Copyright 1917 by D. Appleton and Company. Printed in the United States of America. To my beloved father, this book is affectionately dedicated. Preface. The advance of urology in the past decade has quite destroyed the value of the volume of which this is the successor. Not only have the sections devoted to cystoscopy, radiography, renal function test, renal infections, and tuberculosis been rewritten throughout, but the viewpoint from which we now regard gonorrhea, prostatism, syphilis, and many of the operations upon the urinary organs has so changed that those sections also have been radically altered. Indeed, excepting only those chapters descriptive of the early lesions of syphilis, not a single page of the older work but has suffered some change. We hope for the better. The general scheme of the volume remains the same, though some of the chapters have been rearranged for greater clarity of presentation, and syphilis, which does not properly belong to urology, has been relegated to an appendix. The present volume is founded much more on personal clinical and pathological experience than its predecessor, and while the work of others has been freely quoted, it has seemed essential for unity of presentation that much purely statistical material be simply referred to in footnotes. More than 50 illustrations have been added, about half of these being radiographs, for the greater number of which we are indebted to Dr. Byron C. Darling, for a minority to Dr. E. W. Caldwell and Dr. L. G. Cole. Gratitude is also due to Dr. B. S. Behringer for assistance in many ways, and to Dr. E. D. Behringer, whose chapters on gonorrhea in the female have been retained. To the laboratory staff of Cornell University Medical College is due whatever scientific sanity this book exhibits. Its errors in science as well as clinical matter may be imputed only to the author. Edward L. Keyes, Jr., New York. Contents: the principles of urology, physical examination, urinalysis, urethral instruments, their asepsis, the passage of urethral instruments, cystoscopy, cystoscopy of the diseased bladder, ureter catheterism, estimation of the renal function, radiography, gonorrhea, its social aspects and prevention, the gonococcus, gonorrhea, the extragenital types of inoculation, the systemic manifestations, ocular gonorrhea, gonorrheal vulvovaginitis in children, gonorrhea in women, gonorrheal urethritis in the male, symptoms, course, and complications of acute urethral gonorrhea in the male, course and complications of chronic urethral gonorrhea, non-gonorrheal urethritis, diagnosis of gonorrheal urethritis, urethroskopy, methods and drugs employed for the local treatment of urethritis, systemic treatment of urethral gonorrhea, local treatment of acute gonorrhea, local treatment of chronic urethritis, diseases of the urinary organs, spasmodic and congenital stricture, organic stricture of the urethra, etiology, pathology, symptoms, results, diagnosis, stricture of the urethra, prognosis and treatment, the prostate, anatomy, physiology, prostatism, symptoms, diagnosis, and prognosis of prostatism, treatment of prostatism, malignant neoplasms of the prostate, neoplasms of the urethra. Etiology of infection of the upper urinary tract, pathology of renal infection, the clinical picture of renal infection, diagnosis of renal infection, treatment of renal infection, cystitis, urinary calculus, varieties, etiology, treatment other than radical, renal and ureteral calculus, calculi and foreign bodies of bladder and urethra, genitourinary tuberculosis, tuberculosis of the kidney, tuberculosis and simple ulceration of the bladder, tuberculosis of the prostate and seminal vesicles, movable kidney, the ureters and their diseases, hydronephrosis, physiology and various diseases of the bladder, diseases peculiar to the female bladder, idiopathic renal hematuria, varicose veins of the bladder, cyst and tumors of the kidney, tumors of the bladder and urethra, injuries to the kidney and ureter, aneurysm of the renal artery, wounds and ruptures of the bladder and urethra, malformations of the kidney and ureter, malformations of the bladder and urethra, diseases of the genital organs, diseases of the scrotum, anatomy, physiology, embryology, and anomalies of the testicle, inflammations of the testicle and epididymis, tuberculosis of the epididymis, diseases of the testicle, hydrocele, hematocele, spermatocele, chylocele, diseases of the vas deferens and spermatic cord, diseases of the seminal vesicle, derangements of the genital function, diseases of the penis, anatomy, injuries, inflammations, phimosis, paraphimosis, tumors of the penis, chancroid, operative surgery, general considerations in operating on the urinary organs, operations upon the kidney, operations upon the kidney continued, operations upon the ureters, anatomy of the bladder, suprapubic operations, median perineal section, operations upon the prostate and seminal vesicles, intravesical operations, operations for the cure of urinary fistula, operations for malformations of the urethra and bladder, operations upon the scrotum and its contents, operations upon the penis, appendix, syphilis, the general characteristics of syphilis, etiology, serology, and pathology of syphilis, the course of syphilis, diagnosis of syphilis, treatment of syphilis, the initial lesion, syphilis of the skin, general characteristics, secondary syphilids, secondary syphilis of the mucous membrane, tertiary syphilids of the skin and upper respiratory tract, syphilis of the nervous system, the eye, the bones, the viscera, and other regions, hereditary syphilis, index. List of plates, list of illustrations in text.